So I just demonstrated how to do the neural flossing for the lower extremity, and I'm going to demonstrate on myself how to do the upper extremity nerve flossing. So remember, there's the median nerve, radial nerve, and the ulnar nerve. For the median nerve, I'm going to start with my hand in towards my chest, and I'm going to bring my hand out towards the side, going into wrist extension. I can bring my arm slightly up into shoulder abduction, extending my fingers backwards. And then if I tilt my head to the side, just like in the upper limb tension test, that's going to cause tension through the median nerve. However, if I want to floss, I need to make sure that I'm alternating. So if I wanted to floss with my wrist extended, I'm going to lean towards the ipsilateral side. And then as I floss, I'm going to flex my wrist and turn my head towards the contralateral side. Again, just alternating back and forth. For the radial nerve, remember that goes along the posterior aspect of the forearm. I'm going to start with my hand in towards my side. I'm going to reach back, so I'm going into wrist flexion and shoulder internal rotation, flexing my fingers. For tension, I'm going to laterally flex to the contralateral side. However, if I wanted to floss, I'm going to first start with the ipsilateral side for lateral cervical flexion, and then I'm going to rotate my shoulder into a slight external rotation and then extend my wrist while looking at going to the contralateral side. So this would be flossing for the radial nerve. Lastly, for the ulnar nerve, I'm going to start with my thumb and my index finger together. Think about making a mask with your hands. If I were in this position and then tilting away, this is going to cause tension through the ulnar nerve. So when I floss, I want to tilt my head towards the ipsilateral side. I'm going to bring my hand out towards ulnar deviation and then look away. Keeping my arm up into about 90 degrees of shoulder abduction. So this is flossing the ulnar nerve.